Hi, my name is Reyna. I'm a board certified nurse practitioner in the state of Texas. And recently this summer, we've been seeing an uptick in pneumonia diagnosis, which is kind of rare in the summer months, but we've been diagnosing it quite a bit here at the urgent care, mostly for children, and we're seeing it in some adults and especially in the elderly. What I wanted to go over or make a video of is something to kind of direct patients or parents or caregivers of the elderly on what symptoms and what to look out for on the pneumonia infection, what they should be addressing, and when to take their loved one to an urgent care or the doctor or the emergency room to get treatment for it. So, what is pneumonia? Most of the patients always ask that. It's an infection that inflames the air sacs in both one or both of the lungs. These air sacs become full with fluid or pus, which we call purulent discharge, that can be accumulated in the lungs, causing the pneumonia infection. Another thing that most of the parents or caregivers will ask is, what are the symptoms? So the symptoms is usually cough, a different kind of cough than your average seasonal allergy type of cough. It'll be more wet and it'll be full of phlegm or purulent discharge when they cough. We'll ask, are you producing any phlegm when you're coughing? It can either be thick or green or yellowish. Sometimes it's clear. It all depends on which type of the organisms is causing your infection. Getting to those organisms, it can either be bacterial, viral, or sometimes fungal. But I digress. Let's go back to the symptoms. We'll also be displaying fever and chills and difficulty breathing, otherwise known as shortness of breath. The range can be anywhere from mild to severe, and when it's severe, it's pretty aggressive, and that would require hospitalization. But in the mild to moderate case, it's something that we can probably address in the outpatient basis here at an urgent care clinic, where we can give you breathing treatment and medications such as antibiotics, cough medications, and some breathing treatments and steroids to help with the infectious process. Again, the causes were either bacterial, viral, or fungal. Who gets this type of infection? Who gets the pneumonia? We usually see it in the elderly population greater than 65 years of age, and in infants and young children, usually around 2 or less. But we've been seeing a lot of children in the age range of 5 to 10 presently in Laredo that are getting the pneumonia infection. And what can we do about it? Well, you want to bring them in. We'll get some vital signs. They'll usually be febrile. They'll have a fever. They'll have their oxygen levels will be kind of decreased, their oxygen saturations, their respiratory rate will be increased, their heart rate will be increased usually. And we'll get a chest x-ray to confirm the diagnosis. And we can do breathing treatments. We can give some antibiotics. And what other things can patients look for? Or caregivers for that matter. You can have chest pain or, when the infant or the child is grasping at their chest, or the elderly as well when they're coughing. In the elderly population, they can have confusion. You'll see the cough with that thick phlegm, the fatigue, fever and chills, nausea and vomiting. That's another sign is that you want to look out for. I know when my son got diagnosed, one of the ways that I knew that he was ill was that he was vomiting a lot of phlegm. And that's something you want to keep an eye on. If that's happening, you want to bring them in so we can get the treatment that they need. How can we prevent it is another question that we get asked is hand washing. You can't stress how important hand washing is. You can also get lots of Lysol around the house and kind of Lysol or Clorox sprays, or kind of wipe down, disinfect the areas. But it all comes down to how well you can wash your hands and prevention. In the elderly, there's the pneumococcal vaccine. In children of school age or preschool, make sure they get vaccinated, and this will help prevent pneumonia type infections. Keep them around, away from people who are smoking or smoky environments, and try to keep their immune system strong. Give them a multivitamin a day, or just have them eat healthy. Lots of fruits and veggies. That goes a long way. And another way that we want to prevent is covering their mouths when they're coughing, or they're around other children who are coughing. The old, what the kids like to call that dab, to stop the spread of the airborne infection. So hopefully that helps. And again, this is Javier Reyna. I'm a nurse practitioner, board certified in the state of Texas. If you have any questions, please drop me a direct message or an inbox. Thanks.